It's preparing. Yeah, it's live.
Excellent. Hi, welcome to Mishti Medical Webinars, series that we as Mishti to Mishti Medical Webinars. It's a series that we do with experts in the domain to bring to you subjects of interest and questions and queries that have come in to us from our community. Today's topic, as we discussed, is all about Omicron. Questions around Omicron, concerns around Omicron, what to do, how to do, what do I need to know? And I'm very proud to introduce our fantastic panel of doctors that we have with us today. We have Dr. Satyamurthy, who unfortunately doesn't have his camera running because of technical reasons, but he is our head of internal medicine here at NHS in the UK and comes with a lot of expertise in COVID and managing COVID across NHS here in the UK. We have Dr. Sudhindra, who's a specialist in pain medicine based out of Bangalore in India. We have Dr. Ajita Pillai, who is a clinical microbiologist and does research in developmental immunology and is based in India as well. And we have Dr. Anna Sharma, who is going to be joining us very shortly, who is a consultant pediatrician in the UK with over 40 years of experience working with kids and has had an integral role in advising around the vaccine distribution around in the UK. So with that introduction of a phenomenal panel, I wanted to kick off our question series on Omicron with the very first question that we have here. Is Omicron actually more dangerous than the variants that we have dealt with before?
I'll take that. So Omicron is the newest variant. So if we have a little time, I could just tell you about the variants of concern so far. So we know that last year a new virus emerged, and after that there have been about 4 or 5 variants. The first one, the Alpha variant, that was actually reported from the UK. Then was the Beta variant, reported from South Africa. Then we had the Gamma variant that was reported from Brazil. And then we had the Delta Plus variant reported from India. That is the currently raging variant, causing all the deaths and hospitalization. It changed from the original virus in the sense it mutated to better attach to human cells. So it's not so much different from the original virus. The original virus was dangerous. The Delta, because it attached better, it was even more so, but with just a few changes from the original. Now we have the Omicron that has been reported again from South Africa. So the physician who first, a very confident physician, I might say, who actually picked up the difference in symptoms due to which she reported it, she took it upon herself to report that. And the WHO took cognizance and gave it a name, and here we are today. So Omicron, by all the information that we have as of now, is not more dangerous than the Delta. With the limited information that we have so far, the number of hospitalization is again due to Delta. There are very few due to Omicron. And we know that it's winter in the...
Oh, I think you're frozen. Dr. Ajita?
Yes, can you?
Yes, you're back. So it's not more lethal or more dangerous.
It is not more, according to the doctor.
Sorry, doctor, that brings me to, you mentioned symptoms and the fact that it had slightly different symptoms.
Correct.
Maybe elaborate a little bit on what are the symptoms of Omicron?
So all this has been described. Dr. Angelique could say, the doctor from South Africa who first reported it. So she picked up cases because most of the symptoms that we were seeing, what she was seeing newly, were very mild symptoms like headache, fatigue, muscle pain, not the usual throat, the nose, the sneeze, diarrhea, none of those things. They were so mild. I suppose she randomly looked for COVID in those cases and found that they were actually COVID and was surprised by it. When she saw 30 in her practice, she reported it. So we know what Delta causes. It affects the lung, there is cough, there's a heavy cold, there are all those things. None of those things are there with Omicron. So the caveat here is that we don't know the symptoms of Omicron across age. We don't know what's happening in little kids. she has seen mostly young adults, and we know that all countries now are screening travelers.
Yes,
So by and large, travelers are young adults. So
that's
we
right.
don't know what's happening at extremes of age. But there are no hospitalizations due to Omicron as far as we know today.
Understood. And Dr. Satya,
Yes.
a question for you. In the UK, are you seeing similar symptoms similar to like pain, headaches, more than breathing difficulties, etc. that we were seeing?
Yes.
Are you
Uh,
seeing
the, the hospital admissions here has been rumbling along at a steady pace, and the Omicron variant is not as raging as in South Africa yet. But the current kind of discussions and information we have, as Dr. Pillai said, the symptoms are quite mild, and hopefully it will not lead to increased hospitalization. There have been some reports as well that they get more sweating than the current COVID variants. So here we are not seeing increasing hospital admissions, but the prevalence has gone up, but it's not leading to hospital admissions. So hopefully it will be the same. And if based on the first reports coming from South Africa, if the infection rates are not translating into hospital admissions, that's in a way good news, really, because it is all self-limiting and people will get better by themselves.
Understood. And that, I assume, because UK has a vastly senior tilted population, so we're not seeing necessarily deaths or more severe cases coming into the hospital from Omicron, which is a bit reassuring, considering definitely there in the country. That brings me to the next question. So, just in terms of symptoms, doctors, what is it that people should be looking out for? Because they're milder, what should be the trigger for people to go get tested? Are there things that you feel like people should consider as potential symptoms that would trigger them to go get themselves tested? Is it sorry,
Dr. Murthy can answer because he sees more in clinical practice.
I would say if anybody has got flu-like symptoms, it is always good for them to get tested, so that mainly to self-isolate themselves and stop the spreading of the infection. I think that's more important for reducing the spread in the community. And as I said, it's mostly self-limiting, and even if it is positive, we would take the same precautions that we used to advise, that they will go by their breathing symptoms. If the breathing symptoms are not that severe, and they monitor their oxygen at home, and if it is normal, more than 94, there's no need for them to take any additional precautions apart from self-isolation.
Understood. That's very helpful, doctor. Can one get Omicron more frequently, given that it's so contagious and it's very flu-like in its nature? Can people get that multiple times in a short course?
I think the nature of the virus is such that it is more infectious. When we look at it from the point of view of the virus, so to say, its primary objective is to stay alive. So what we usually see in scourges that have happened before, for example, we had the H1N1 flu some years ago, and such. So, and even the HIV, if we cast our minds back in the 80s, it was a scourge. What happened over time? Over time, they became infectious, but they did not become virulent. It means they don't kill the host, the people that they infect, they don't kill. Otherwise, there's no point. We know that Ebola and all is limited because they kill the people they infect. So that virus is not widespread. So the same thing we can expect will happen to the coronavirus in future. It will become more infectious, but it will become into a milder and milder kind of virus, so that we would just ignore it for the most part and take a brufen or so. So that is what we expect will happen. And many in the professional circles, they do think that Omicron is the beginning of that stage.
Yeah, yeah. I think what Dr. Ajita is telling is absolutely fine, right? Some people are also telling that Omicron is a blessing in disguise, isn't it, Dr. Pillai?
Yes, that's true. We know that, for example, people were trying to make a live attenuated kind of vaccine in the beginning of the pandemic, and this must people feel that this is a natural selection, something like that, like a live attenuated vaccine kind of thing, because it is so mild and it provides immunity.
That's excellent. So
So
it is
natural vaccine.
Yes. That's a joke in professional circles, by the way.
which is reassuring if you doctors allow
Yeah.
make us common, people
Yes.
reassured that it isn't something that is devastatingly
No, it is not.
like COVID at first, which was a very different tone from you guys.
Yes.
This is reassuring. So I have a question here, doctors, on vaccines. So this is coming from senior citizen within the community asking, I'm double vaccinated. Can I still get Omicron?
Yes.
Definitely,
The short word is yes.
Okay.
Yes.
How long after your I think this is more broadly a question, not necessarily for Omicron, but all variants of COVID so far. How long after the second vaccine is the vaccine still effective? So I think they're getting to the question around boosters, but how long does the actual...
Actually, that question is related to the variant. It is not irrespective of a variant.
Okay.
You see, why? Because we must understand that when the virus mutates, if the mutant is stable, our vaccines will work. So corona is such a virus that it's even though we are seeing variants, its mutations are relatively stable. That means the mutants are not appearing too often.
Right.
You see, so the mutant remains, and after a long time, so that means our vaccines continue to be effective. But this Omicron variant is so drastically different from the Delta. When they have sequences drastically different from the Delta. So that in South Africa, because they have reported it and they're doing more work on it, I think, than other countries. They are seeing that within 4 months of having double-dosed people are getting Omicron. They are seeing that. That is not to say alarming. So that definitely vaccines may have to be tweaked. So they have to be tweaked. And Pfizer, if you see on their website, they say that their current vaccine, 80% of the epitopes that they have used to generate that vaccine are the same as are effective against Omicron. Therefore, they are recommending a booster shot of their vaccine, which they say just ups the level of antibodies required.
Understood.
So other companies, I'm sure they will also tweak their vaccines. That is for sure. But as of now, it is not that the current vaccines are totally ineffective. They are not. So that is what we want to say. We want to say that they are not ineffective. We can't say they're completely effective. That we cannot say. But definitely, this is not the situation as in the beginning of the pandemic. For one, there are so many COVID survivors. So many. For one. Second, most of the world has taken even one dose of vaccine has been taken.
Yes.
The thirdly, we know what to do. We know what to do. So all things considered, we just have to go on vaccinating with the current vaccine. Definitely boosters will be required. For all we know, like the flu shot, we may have to take it for the next couple of years, like a booster shot.
Understood.
Maybe yearly, maybe it might be combined with the flu shot. Why I say that is because when we test, patient who comes in and we want to know what kind of virus has taken hold of that person, at this stage, we are able to look for the flu virus and the COVID virus in a single test. It is possible.
Understood.
So in that way, maybe the vaccine will also be like that. In a single shot, you cover all the common viruses that are going to cause you a respiratory symptom. Something like that.
And that actually brings me to another question that was asked, which was around flu and so can people have flu and COVID simultaneously? That's something that can happen.
Usually not.
Okay.
Not. There have been no co-infections reported so far with COVID and flu. So far, it's not reported as far as I know.
I see. So funny thing is that Omicron may appear to look like a flu, but it's not the flu.
And it's not the flu. The flu is a different virus altogether.
Understood. Although the symptoms may be similar and they may appear.
Yes.
Understood. Next question I have is because everybody's talking about Omicron being so contagious. The question, can it be contagious with the mask? So is the mask the typical precaution we used to wear which was the mask and sanitizing ourselves hands, is that still the that needs to take, or do we have to change something to protect?
Nothing. We go on masking. We go on taking our vaccination. We booster up if possible. We continue with COVID appropriate behavior, and that's the universal vaccination method, so to speak.
Understood. And Dr. Satya, is there anything specifically different that's being done?
I would say that the booster vaccination program has started here, so it has worked really well here. So ideally, everyone should be double vaccinated already, and after the second dose, after 3 months of the second dose, the booster vaccination has been taken. All of them who are more than 40 years old, or if they are having problems with their immunity, like if they're having underlying cancer or any immunosuppression disorders, they had the booster vaccine after 8 weeks of their second vaccine here. It seems to have worked really well here. The symptoms, even, I mean, people can get, even if they're double vaccinated, they can get COVID, even the Delta variant, but the symptoms are much milder. Much milder. And the only patients that I see who go on to intensive care and struggle are people who are not vaccinated. So it definitely worked. So if anybody on the program who's listening to me, double vaccination is a must. And then depending upon what the Indian government says there about the booster, then that should be taken accordingly. And in the future, it might keep on mutating, and you might need a booster dose, or it might just fizzle out. A lot of coronavirus in the past had just fizzled out, and we never had problems. So no one knows, but we hope that this also fizzles out, and probably the Omicron might be a one which is more contagious and just gives us herd immunity with a less serious symptoms in majority of the population. That might be a kind of a blessing in disguise. We don't know that yet, but we'll see how it evolves. Thanks.
Right. But the early days in terms of what you are seeing across the board in the UK, in South Africa, and India and other places, doesn't seem to ring the same alarm as the Delta did, for example. It's definitely at a different scale in terms of the
Yes. It seems to be a devolved version of the earlier variants.
Understood. That actually brings me to a bunch of questions on the booster. So I think the first question I've got is, are the boosters equivalent from different drug producers? So is a Pfizer same as AstraZeneca? Are they the same?
They are not.
Okay. Are they?
So the technology is different totally.
Okay.
Maybe the Pfizer and Moderna are already on the job of tweaking their vaccines. We don't have any information about the others.
I see. So are Pfizer and Moderna the first ones to be coming out with a potential booster?
Probably because they are both mRNA vaccines, and maybe the technology is easier to tweak rather than, the AstraZeneca is a different type of vaccine. So maybe we don't have any information, but though Pfizer and Moderna are very clear about it, they're already on the job, and it may come out early next year is what the news said.
Understood. So Dr. Satya and Dr. Anna, I see you here. Dr. Anna, welcome. I know you had technical difficulties joining in earlier. But quick question for you. So when we're talking about the booster being rolled out in the UK, what is this booster? This is not the tweaking of the existing vaccine. Is it just a second dose of the second vaccine, essentially?
So in the UK, we already have a 2-dose vaccine policy. The booster is a third dose, in fact. So the third dose is being rolled out it's been approved for everyone aged 18 or over who's already had 2 doses. And it's now being rolled out to everyone 40 and over. as long as there's been at least a gap of 6 months after the second dose. There's consideration being given to closing the gap to 3 months, because we know that after the second dose, immunity, B cell immunity wanes 3 to 5 months after the second dose. So when it comes to boosters, I think what's important for India is that those who haven't had your second dose, it's really important for you to have your second dose. So that's the main thing. And so far, India, there was a statement on Friday, as you all know, that so far India is not thinking to roll out a third dose booster policy. So that's important. But you must have your second dose. And in relation to all the vaccines and whether they are effective, so as you already highlighted in your talk, I was able to listen in. Delta is still the predominant variant. So it's very important to realize this. Delta is still the predominant variant. It may not be the predominant variant in 3 weeks' time, but right now it's still the predominant variant. And WHO knows, and we know, that every single vaccine, whether it's the UK, USA, India, China, all the vaccines do have some protection. They do give some protection against Delta. So it's slightly less protection, and the protection for one dose is not that great. Though if you have had one dose, you can't consider yourself as protected. But if you have had 2 doses, then you can consider yourself that you do have protection against severe disease. You don't have protection against getting the infection, but you have protection against severe disease. So I would strongly recommend that anyone who has not had 2 doses, please get 2 doses.
That actually brings me to a very important question, doctor, which is who are the cohort of people who you would recommend not to get the vaccine? So there are a few select set of people. Who would those be? Why would they qualify not to be eligible to get a vaccine? Could you maybe elaborate on that?
Are you asking me?
Sure, Dr. Anna, if you want to go for it. Anyone.
There are very, very few contraindications to the COVID vaccines, okay? So the major contraindication is if you've had a severe reaction to 1 dose of the vaccine, okay? So if you've had anaphylaxis, so a severe reaction means, in medical terms, anaphylaxis. Anaphylaxis is shown by tingling of the lips, breathlessness, very severe skin rash, and heart beating very fast. It comes on immediately after the dose of the vaccine, within half an hour. And this is why they make you wait at the vaccine site, okay? It's treated by giving an injection of adrenaline. But if you've had 1 dose of anaphylaxis following a vaccine, you shouldn't have the vaccine, that same manufacturer's vaccine, that's for sure. The second thing is that some people have severe food allergies, so severe that they carry the adrenaline in an EpiPen around with them. Okay, so in other words, that after some kinds of foods, most commonly peanuts, within half an hour of taking these in, they get the tingling of the lips, breathlessness, very fast heart beating. So that kind of very severe allergy, I don't mean asthma, I don't mean eczema, very severe immediate allergy. So those people also, very great caution before taking the vaccine.
Okay, understood. And maybe Dr. Ajita and Dr. Sudhendra, from an Indian perspective, are there any segments of the population, whether they're elderly with any sort of conditions, are there any that are being excluded or advised?
No, I think
No.
I think to keep the message very clear in India, short and crisp, because when you do over messaging, people can get confused. Basically, the simplest statement would be is everybody over 18 is eligible for a vaccine.
Okay. And there aren't any exclusions, no recommended exclusions there?
Dr. Ajita?
There are no exclusions. People are encouraged, and the symptoms are looked into. The only clear indication, as Dr. Anna has said, it's only anaphylaxis.
Correct.
And,
Okay.
and that's all. So even the pregnant with people, pregnant ladies, or even with other illnesses, people are scared. Okay, I'm diabetic. Can I have a vaccine? They are encouraged. They are encouraged. And there are people with, for example, bleeding disorders. With precautions, they can also take the vaccine. Like,
Understood.
Yeah.
Also, I do think we got a question from somebody who did have a bleeding disorder. So I'm glad that you brought that up.
Okay. Okay. So they just have to be in a higher center that can deal with any fallout of taking the vaccine, and that's it. There's no problem.
Understood. Question again on the booster. So if I've had a Pfizer, if I've had a Moderna vaccine shot, do I have to stick with their boosters? Is that going to be something that we're going to be told in the future, or are manufacturers making it such that it can be universally distributed?
I'm sure manufacturers, as of now, there has been a mix and match of vaccines, and any combination seems to have been viable and giving a good level of neutralizing antibodies. So I'm sure. So now, because of the Omicron variant, people will surely change a little bit of the vaccine so that it can be mixed and matched again. We all know still there is a shortage, and not everybody is able to afford or have the vaccine available in wherever. So mix and match will be the need of the hour as it is now, and it will be in the future too, I think.
Understood. And quick question, I think you already mentioned that, but what is the age group eligible for boosters? I think you said 18 and above in the UK. Is that right, Dr. Anna? Is that the same in India as well?
That's absolutely right.
Yes.
It's 18 and above in the UK. I just want to reiterate Dr. Ajita's point about pregnant ladies, because earlier in the vaccine program, there was a lot of hesitancy from pregnant ladies.
Yes.
Worried.
That's right.
We really know now that pregnant ladies who get COVID can get very seriously ill. So it's very, very important for pregnant ladies to be vaccinated with the COVID vaccine. It's the same thing for diabetics. If people with diabetes get ill with COVID, we know that they can get severe complications from the diabetes and from COVID. So people with diabetes really should get the vaccine. Booster doses mix and match. So what we've now realized from both in vitro, that means in the laboratory, and real life studies, we know that it can be a good thing to mix and match. So we know that, for example, in the USA, people who've had 2 Pfizer, they're getting their booster of Moderna, or people who've had 2 Moderna, they're getting a booster of Pfizer. So the encouragement is that the boosters, if possible, should be an RNA vaccine, but we also know that booster doses of the Covishield, Oxford vaccine, also are really useful, and all the booster doses in the UK are mRNA vaccine.
Okay, since you mentioned all these terms and I am a layman and don't understand any of them, can you simplify that for me? Why does it need to be an RNA vaccine versus an mRNA vaccine? What's the difference? What do I as a layperson need to know about it?
I'm sorry, mRNA vaccine is in fact it's an mRNA vaccine, sorry.
Okay, so is an RNA vaccine more effective as a booster? Is that what you mentioned? So
that's the current evidence shows that the messenger RNA vaccines, which are Moderna and Pfizer, are slightly more effective when given as a booster against Delta. Okay, that's certainly the early data. The more recent data show that any vaccine, whether it's Covishield, it doesn't have to be an mRNA vaccine, it can be any COVID vaccine, is much more effective when given as a booster.
Understood. So I think that covers my list of questions in terms of the symptoms, the boosters. Maybe I'll ask you a couple of questions in terms of what are your thoughts on the future. Does Omicron look like it's going to cause another global shutdown, or do you feel like we've kind of reached a new level in the virus where we've decided to cohabitate on the planet without causing too much trouble? Dr. Pillai, maybe I'll start with you.
probably in the beginning of the pandemic and we didn't know what to do, we literally bolted to our homes, and the lockdowns happened. Now we have learned to live with it. And as I said before, the situation now is not as earlier. We know what to do. We know what works. Even if we know how to deal with consequences. So there is no longer the need for shutdowns and travel bans, because the fallout has been great, as we all know. The effect of lockdown in terms of livelihood, in terms of damage to people, and all these things. So, and if the variant is milder and we have vaccines available, we probably would not shut down. Because in that sense.
That's the perspective.
Yes. So I think that should work. In fact, we want the world to be whole again.
Absolutely, I can't wait.
Yes. So people are hesitating, and not everybody is going in to suddenly shut themselves off.
Dr. I know you wanted to add something to that as well.
I think it's too soon to know, actually, because it's not totally clear that it's a milder illness. We know that so far in South Africa there have been very few hospital admissions compared to the Delta wave. But hospital admissions usually come 2 to 3 weeks after infection. So it's still a little too soon to know. The other thing we do know is that it is a highly transmissible variant. So I'm sure you've all mentioned, there's been a famous outbreak now in Norway, in a restaurant in Norway, where 120 people came to dinner who were all doubly vaccinated, all had a negative lateral flow test. And of 120 people, over 2/3 of them caught COVID just from being in the restaurant, and 17 of them are confirmed as the Omicron variant. So we know it's a very highly transmissible variant. You're much more likely to catch it than you ever were going to catch Delta. It's at least 2 to 3 times more transmissible. Now, what this means is that even if you have fewer hospital admissions, because it is more transmissible, the number of admissions in the end can be quite high.
Okay.
Yeah, if many more people get it, then there will be hospital admissions. So I think it's too soon to know. And only yesterday evening, this question was asked from some of the very great international experts. It's far too soon to know. If this was Delta, we would be in lockdown. I think that's the point.
Okay.
Because people are being... The messaging is that you should wear a mask. The messaging is that you should keep your social distance. The messaging is that you should not go to indoor gatherings. And if people wear a mask, if people keep their distance, if people do not go to indoor gatherings, there is a chance that we can avoid lockdown by getting boosted in the meantime, and perhaps a little bit more data will emerge. But I think it's too soon to say that there will be no lockdown. I agree with the international travel. We know that it's already spread all over the world. So
yes,
understood. So exercise a bit more caution. We wait how things evolve. And to your point, Dr. Appalai, that you mentioned earlier, because this variant is so contagious and so highly transmittable that hopefully it is one that wants to stay alive and therefore not necessarily try and bring down the host. So hopefully we are reaching a stage at a variant which is actually going to be able to kind of, persist, but not necessarily cause too much damage as it transfers around. So we'll keep a close eye on how things evolve. But thank you very much. I know, Dr. Anna, you put together some slides earlier. Is that something you want to very briefly go through before we call it on the panel?
Okay, yeah. I just want to point out that in terms of thinking that the virus wants to stay alive, so a virus is not a sentient being, okay?
Right.
It has no desire to stay alive. These mutations are random mutations. It's a totally random thing. Because of random mutation,
Yeah.
Some mutations emerge as being more infectious. There are many other mutations that are not more infectious. So it's totally random. We have no control over it. I'll show some slides if that's okay.
Of course.
I'll see if I can to share my screen. You have to make me a co-host.
Yep. There you are.
Okay, thank you. So if we start from the first slide, can you see this?
Yes.
This goes back to your question, which you've already answered. Are the symptoms the same as Delta? So we now know, and particularly as you were already saying, a lot of the data comes from South Africa. Omicron, the cough is less of a feature. Breathlessness is less of a feature. And with Omicron, people have noted that they're not getting that loss of sense of taste and smell, okay? So if you have a sore throat, if you have a runny nose, if you have a headache, feel really tired, it's possible you might well have Omicron. You might also have Delta. Okay, next slide, please. Can they happen at the same time? Yes, this is possible. They may well happen at the same time. And it's possible that we may be entering what's called a twindemic, which is a pandemic of both Omicron and Delta at the same time. I'm double vaccinated. Can I still get Omicron? Yes, we know you can. So please keep your distance and your mask. Next slide. This is just, I'm sure you've all seen this. It's an excellent picture from the New York Times protein folding study, which shows the different ways in which the huge number of variants on Omicron, which means it's more transmissible, more infectious. It does escape vaccines and it does bind to, but the good news is that it binds to the same protein receptor that vaccines neutralize. So the vaccines work. Okay, they don't work as well, but they work. I won't show you this. This was a map of the spread. Please, next slide. This was a map of South Africa. I thought you might all be interested. So the blue, dark blue, is Gauteng province, where the previous capital Johannesburg was. This is where the Omicron was first identified, and we take our hats off to this massive international collaboration of genetic scientists that they alerted the world, and that's fantastic. So next slide. This is really to show that there is some indication so far that it's less severe. The grey slide is the hospital admissions. The orange in this slide is the actual cases. And as you'll see, cases are going right up, but hospital admissions are not. And that's a good sign in South Africa. Next slide. This is age group. So 2 weeks ago, South African data was a little bit worrying because they were seeing admissions of children that's under 5 years old. This was a little bit very worrying, actually, because with Delta and Alpha, Wuhan strain, we didn't see children getting hospitalized with COVID. This is this week's data, however, Friday's data. And what this shows is that it's not so much the children, it's still the older people. In South Africa, they're very much an unvaccinated population who are getting admitted. So it's people who've had no vaccine doses at all. So in India, if you have had 2 doses of vaccine, you are partly protected. Next slide. This is a restaurant where the outbreak was. It's the inside and the outside, just to show you that they weren't all necessarily crowded together. They weren't clubbing and dancing, you know, cheek to cheek. They were sitting at this restaurant. And this is the statement from the Norwegian Institute of Public Health. So, you know, there were 120 participants, of which nearly 100 got COVID, some of whom were not even sitting at the same table. So please, avoid indoor gatherings. That's the message. None of them have been hospitalized. They were all double vaccinated. So vaccine does protect against severity. Next slide. Indian statement from Friday, and has been an update now. So India has now detected 32 cases. Everyone has only been mild. Though the health ministry in India said on Friday there's no immediate plan to authorize a third dose in India. Next slide. This is really a sort of, how high are the cases rising? Very, very, very quick rise. So just that word of caution, that first of all, 2 cases today is 4 cases tomorrow, 8 cases this week is 256 cases in 6 weeks' time. Though the doubling time is 2 days, 2 to 3 days. So, for example, 32 cases in India will be 64 cases in 2 days' time. And we have to bear that in mind. It's very, very quick. In 2 weeks' time, we'll know much more. Next slide. That's it, I think. Thank you.
Thank you so much, Doctor. That was super helpful, super informative. Really appreciate it. Thanks for pulling that together. And with that, I want to thank all of you on the panel. It's been a super informative session. Thank you for addressing all the questions from the community. And I hope this gives people a little bit of reassurance and also clarity on how they need to deal with Omicron, should they be worried, what kind of precautions they should take. And please get yourself vaccinated. If you haven't heard the message loud and clear, every single member on the panel reiterated the importance of you being vaccinated. There aren't any exclusions in the recommendation of who should get vaccinated. There are additional precautions and care that the hospital can take should you be more vulnerable. So please, if you haven't been vaccinated yet, you shouldn't be thinking about it. This is something you should just do for yourself and your family. With that, thank you very much, panel, for making time for us today. Thank you for addressing all our questions, and please stay safe and speak to you again.